Welcome to Module 2. In this section we will be looking at some common general abbreviations and also recapping a few suffixes and some prefixes before we get to the nitty-gritty in Module 3. In medicine there are thousands of medical abbreviations, but there are some general abbreviations which are used as shorthand really when making notes on a patient. Let's have a look at these. Let's look at the first one on this list. Patient complains of. If you imagine that you are the patient going in to see the doctor, and you sit down and you have your chat, and the doctor may note down something like PCO, chest pains on exertion. So the patient has complained of chest pains when they're walking or doing any sort of exercise. If the doctor is unfamiliar with you, he may ask about your family history. So for example, in my family, my father had a heart attack when he was around 55 years old. Then he will want to look at your past medical history. So perhaps as a child you may have had asthma, so PMH, asthma. And your current history, HX for history or HO, well, you may currently have hypertension. We had that word earlier, hypertension meaning increased tension relating to high blood pressure. Your drug history, obviously very important. So perhaps in the past your DH was Ventolin due to the asthma. Helps open up the airways to help you breathe. And antihypertensives, so drugs which work against the high blood pressure. On this slide we have date of birth and YOB for year of birth. So DOB I'm sure you're very familiar with for date of birth. OE means on examination. So if you present to the doctor with your symptoms, he or she may want to examine you, give you a prod and a poke, see if they can find anything abnormal. But it might be on their notes that they write OE on examination. There was NAD, which means nothing abnormal detected. SX is an abbreviation for symptoms, and symptoms literally are the signs that the patient presents that something is not right. So SX may be written down as chest pains on exertion, so very similar as patient complains of. IX means investigations. So if you are presenting with your chest pain, the doctor is going to want to find out more. Is there something more sinister going on? So let's have a look at some investigations they might perform. The doctor may want to do what's called an FBC, as a full blood count. U's and E's, which means urea and electrolytes, and ECG, which monitors the heart rhythm. So FBC would be the full blood count. U's and E's are urea and electrolytes. Both of these tests actually require a blood sample. The full blood count is looking at your cells within your blood, your white cells and your red cells, and other bits and bobs within your blood too. And U's and E's relate to the urea, which is a waste product which you produce when you eat protein, and electrolytes, which are things like sodium and potassium. So these two are actually very common blood tests and very important. And if the doctor is wanting to look at your heart rhythm, an ECG would be performed. This stands for an electrocardiogram. We'll talk about these things later in the course. Having just mentioned the term U's and E's for urea and electrolytes, well here we actually have two electrolytes. K, which comes from the Latin term kalium, means potassium, and Na is the abbreviated form for natrium, which means sodium. So potassium and sodium are electrolytes, and if these are out of balance you're going to feel quite poorly. So let's have a look at a term associated with potassium. Hyperkalemia. we're going to break this down. Hyper, break, K, break, AL, break, emia. Now, one of our suffixes earlier was emia. It meant a blood condition. AL couldn't mean relating to. K is our potassium, and hyper is excess or too much. So, putting this all together, we have a blood condition relating to excess potassium. Let's look at the sodium example. So Na we now know means sodium. So let's look at this one. Hyponatremia. Hypo, break, Na, break, Tr, break, emia. Well, emia is our blood condition. The Tr bit, you can see, actually comes from the Latin term natrium, but I've separated it out so you can see that the symbol Na is used in the word, and you become familiar with that as an abbreviation for sodium. And hypo means reduced or insufficient. So what we have here is an emia, blood condition, Na, sodium, hypo, reduced, not enough. It means a blood condition of insufficient sodium. The next term is diagnosis, and this is represented by a triangle. And diagnosis means the doctor or the nurse has made a diagnosis. They have decided they know what is wrong with you. The hash sign means fracture, so you may have broken your leg or your arm. The degree sign, like a little circle, and then a word next to it, in this case I put jaundice, this would mean no jaundice, and jaundice means yellowing. So in this case, a patient has no yellowing of their skin, which would relate to a condition associated with a substance called bilirubin. And we'll talk about that sort of thing later. Plus VE or minus VE means positive or negative. 1/7 means 1 day out of 7. 1/52 would mean 1 week out of the 52 in a year. 1/12 relates to 1 month. It's time now to do the exercise we call in your head. On the left, we have a list of prefixes. So do have a look at those, please. See if you can work out what they mean and match them up with the list on the right-hand side. You don't need to press any buttons, just look at the screen and test your memory, really. And all will be revealed shortly. Let's look at the first one. Peri. Nyom. Peri means around. So, for example, pericarditis would be inflammation around the heart. A or an at the front of a word means no or lack of or without. So somebody suffering with anorexia is without appetite. Braddy. Slow. Brady means slow. So if a patient has bradycardia, they would have a slow heartbeat. Tachy means fast. So if you have tachycardia, it'd be a fast heartbeat. Hyper means excess or raised, too much. Or we had the term earlier, hyperkalemia, a blood condition of excess potassium. Hypo, reduced or below. So if I have hyponatremia, I have a blood condition of reduced sodium. Hypo, if you think hypo for low, it will help you remember. Dys means difficult or disordered. So somebody may suffer with something called dysphasia. That would mean difficulty speaking. Endo means inside. Patient may have endocarditis. That would be inflammation inside the heart. And last but not least, anti is against. An example we had previously, antihypertension or antihypertensive, would be a medicine which is against high blood pressure. It's quiz time! This module was actually quite a short module, so consequently in the quiz time you will be revising your prefixes and suffixes and some of the general abbreviations we have covered. If you look to the left, you will see where to click for your quizzes.